shall be differentiating between infection, sepsis, and septic shock. Remember, in our last video, we explained the fact that sepsis is a condition that kills mostly in our less resource settings because we lacked the resources to take care of patients who are having sepsis. And we said it was important that we understand how this condition comes about so that we can be able to prevent, we can be able to identify, and we can be able to manage it appropriately. So in today's video, we shall be distinguishing between an infection and sepsis and septic shock. So the first thing, we all talk about infections, whether it's malaria, whether it's urinary tract infections, whether it's respiratory tract infections. But unfortunately, we find ourselves in a mix of not being able to differentiate between an infection and sepsis. So for us to be able to understand what sepsis is, it is also important that we remind ourselves of what an infection is. An infection simply comes when a microorganism lodges in a sterile part of our body. When we say a sterile part of our body, we're simply saying that that microorganism normally is not supposed to be there. But when it finds itself in that part of our body, it multiplies, and from there it causes a disease. This is what we call an infection. Now, how do we know that it is not more malaria? It is not more meningitis. It is now sepsis. So for clinical importance, for clinical imperatives, it is good that we understand sepsis as a life-threatening condition. A life-threatening condition which comes as a result of injury to our tissues and organs when the body is responding to that infection. So it's a life-threatening condition that comes as a result of a dysregulated response to an infection. And for more clarity, it is important that we understand what we mean by life-threatening. Life-threatening is a condition with high probability of someone dying if the cause of that infection or that condition is not arrested. That's what we mean by life-threatening. So if you have malaria and then your lungs starts not working well, or your brain starts being dysfunctional, if we don't stop this malaria from progressing to that level, the likelihood that you're going to die is high, or the likelihood that the patient is going to die is high. And that's what we call life-threatening. Any condition that the likelihood of someone dying from it is high means it is life-threatening. And that's why we say sepsis is a life-threatening condition. When we say organ dysfunction, what do we mean here? So when you hear of sepsis and we say organ dysfunction, it simply means our organs, they are no more functioning well. They are not going to be functioning well. they will switch from the normal function to being dysfunctional. We know of the different organs in the body. We can start from the brain. What is the role of the brain? The brain is there to ensure that we reason well, that we walk, we think, it regulates our memory, our temperatures, how we feel, cold or hot. It's the role of the brain. When the brain becomes dysfunctional, when it is no more working well, what happens? That's when you see a patient lying in the hospital bed, or lying in the house, unable to talk, unable to walk. Patient cannot reason. The patient is in the hospital but feels that he or she is in the house. This are signs to tell us that there's a dysfunctional brain. The brain is not working well. What about the lungs? We know the lungs, they are important in taking in fresh air, reaching oxygen, and sending out waste product in the form of carbon dioxide. When our lungs aren't working well, what happens? We can't take in oxygen, we can't send out waste product in the form of carbon dioxide. And the accumulation of waste in the body is in turn toxic to our tissues and our organs. And that's how our tissues and our organs will continue to fail. Take the kidneys. The kidneys, they cleanse our blood, they cleanse the body of waste products. They also ensure that the quantity of water in the body remains normal. And that's why when it is abnormal, or that's why when the fluids in the body are high, the kidneys will eliminate more through urination. And imagine the kidneys not working well. What happens? This waste will accumulate in the body. Excess water will accumulate in the body. And as they are accumulating in the body, they are toxic to the cells and the tissues and the organs. That's to say the kidneys are not working well. We can talk of the liver. The liver is in charge of doing what? Of breaking down the nutrients that we take into substances that are useful to the cells, that are useful to the tissues and to the organs. The liver is also responsible for breaking down those drugs that we take. So when we say the failure of organs, or that the organs are dysfunctional, in the context of sepsis, we're simply saying that these organs are not working normally as they are supposed to do. So when we say in the presence of an infection, there's a dysregulated response. What are we saying here? We are saying that the response to an infection is out of normal. When we say response to an infection, there are two factors that influence the response to an infection. The first is the host. When we say the host, we are referring to that individual. And there are parameters to define what the host is. It can either be the age of the patient. So the way an individual is going to fight an infection is determined by the age of that individual. And when we are talking of the age, we are looking at extremes. We are looking at those who are too young. We are looking at the newborns. We are looking at our children, newborns, kids, immature immunity that is not yet ready to fight an infection in a way that we young people can do, because we have immature immunity. For our grandparents, their immune systems are weak, and that's why they cannot fight an infection. And this is to say, in other words, these are the people that we need to protect. These are the people that we need to prevent them from going to sepsis. Because when they have sepsis, the likelihood, the probability that they will die is higher than when we do. When we also talk of the host, we are referring to those with other disease conditions, those living with other disease conditions like hypertension, diabetes, disease affecting the respiratory system. Those people, they are more fragile. The way they will fight an infection is not the same like the way we do. So these are the vulnerable population, those who are vulnerable of developing sepsis. So we need to prevent this population from having these infections, whether at the level of our families, level of communities. Also remember that most of the infections are gotten at the level of the hospital. The patient comes with a different infection or a different problem and finds himself or herself suffering from another infection that he or she got from the hospital. So that's why our interventions need to start at the individual level, family level, community level. At the level of our health institution, infection prevention and control needs to be at the top. We need to prevent patients from contacting infections from our hospitals. This is going to go a long way to reducing hospital-acquired infections, hospital-acquired sepsis. So it is vital that our interventions are geared towards preventing patients from acquiring other infections that they didn't have when they arrived at the hospital. So this is what sepsis is. And also for clinical importance, if we are wondering how we see someone with sepsis, though it is going to be detailed in our next video. But for clinical importance, how do you see that this is someone with sepsis? I don't always like to complicate by saying that we need to look at fraction-inspired oxygen. No, we do not even have this in our settings. Most of our patients will lie in our emergency departments with sepsis. They will not be in an intensive care unit. They will be in our villages, in our health centers. We need to identify that this is a patient who is possibly having sepsis. It's better to treat someone with sepsis or identifying that this is a potential case of sepsis than thinking that this is just an infection. So it's good to have that high suspicion to say that this is someone who had an infection, but I'm thinking it is no more an infection. It is possibly sepsis. And I would like us to just take 3 parameters. And the first parameter is our respiratory rate. The respiratory rate of a patient is very crucial. It's very important. Once you discover that in the context of an infection, the respiratory rate of a patient starts going up more than 22 or equals to 22 breaths per minute, this is an indication to tell you that something is going wrong somewhere, and you need to have that high suspicion of sepsis. That is the first parameter. The second parameter is the blood pressure. When we take the blood pressure of the patient and discover that the systolic blood pressure is no more going above 100 millimeters of mercury, please think sepsis. Mental decline is another important parameter that we need to put into context. When we say mental decline, what do we mean? The patient doesn't know where he or she is. He or she forgets. The patient is disorientated. It means that he or she doesn't even know where he or she is. He doesn't know the time. He doesn't know the person with whom he or she is. Patient is confused. Patient is agitating. These are all signs to tell us that the brain is not working well. So once you have all these parameters in place, respiratory rate equals to or more than 22 breaths per minute, blood pressure of less than 100 millimeters of mercury systolic, mental decline, confusion, forgetfulness, disorientation, please suspect sepsis. These three parameters, once you start seeing these parameters in place, think sepsis. It is important that we see sepsis in a patient lying in front of us. Remember, our settings will not tell us from the lab that this is sepsis. We have to see sepsis in the patient. Now, how do we know that it is no more sepsis but septic shock? How do we see that this is sepsis, septic shock? Yes, we know when we are talking of septic shock, we are referring to vascular dysfunction, cellular and metabolic dysfunction. This might complicate us seeing in a patient. But for us to be able to take care of this patient, to say that this patient is having septic shock, there's one thing I always say, there's one thing that I would like us to take. And that one thing to see septic shock in a patient is simple. Somebody is having sepsis. You start administering fluids, you start giving the patient ringers, you start giving the patient saline. As you are giving the patient fluids, the blood pressure doesn't change. The blood pressure, instead of going up, goes down. There's what we call refractory hypotension. Refractory hypotension simply means blood pressure doesn't change with fluid resuscitation. If we like, we'll go and take a drop of water and infuse into the patient's veins. The blood pressure won't change. Once you see this, know that the only thing that is going to raise the blood pressure of that patient is a vasopressor. So any blood pressure of the patient that we need to raise with the vasopressor in the context of sepsis is septic shock. This is the difference between sepsis and septic shock. So, dear viewers, we would like to know from you how sepsis or septic shock is seen in your different contexts, your different health institutions. How do you see sepsis? How do you see septic shock? Let us know in the comment section. Let's discuss how sepsis is differentiated from septic shock. So if you enjoyed these updates, remember to like our video, share and subscribe to our YouTube channel for latest updates to come. Thank you for watching.